Hi everyone, welcome back to the Limbus Med channel and this side Dr. Ankit. And today we will study the pharmacology by the PYT topics, that is previous year topics. So what are those topics that is previous year, like previous year topics which are being asked in your exam? And in this pharmacology series we will complete the 6 lectures and today will be our first lecture. So let's start this. In general pharmacology, the kinetics and the distribution, they are the PYTs which are being asked, and let's go through them. In order of kinetics, in dose and concentration graph, in first order, the drugs which follow the first order, the dose and concentration remains directly proportional to each other, and in zero order kinetics, the concentration increases up to some extent and then it remains constant like this. And now by a tabular form we'll study the difference between zero order kinetics and first order kinetics. Firstly, the elimination. The zero order kinetics eliminate the constant amount, and in first order they eliminate the constant fraction. And the concentration relation, the zero order is independent of the concentration and first order kinetics are dependent. Plasma concentration is unpredictable in zero order and it is predictable in your first order. Risk. Toxicity prone in zero order kinetics and in first order it is linear or safe. So by a mnemonic that is PEWFM, we can memorize the drugs which follow the zero order kinetics. PEW stands for P stands for phenytoin, E for ethanol, W for warfarin, that is high dose, F for formerly aspirin, and M for methotrexate, that is also in high dose. The trap, the examiner that they can give a trap in the question, like the phenytoin, this is a dose dependent kinetics. This phenytoin drug follows this dose dependent kinetics, and it can shift from first to zero order. If the dose increases, it follows a zero order kinetics, and in the starting phase it follows a first order kinetics. Okay, then we move to the next topic, that is P-glycoprotein. The P-glycoprotein that acts like a doorman, and what is the function of it? It is ATP dependent efflux pump, and it throws drug out of intestine, brain, placenta, and kidney. Okay, and now we'll study the inducers and inhibitors. Inducers are your rifampicin, St. John's wort, phenytoin, carbamazine, and inhibitors are verapamil, amiodarone, clarithromycin, and ketoconazole. What's the trap in this? P-glycoprotein inhibitors, they increase digoxin toxicity. So if someone is, if examiner is giving a question in which they are giving example of your P-glycoprotein inhibitors, so they can increase the digoxin toxicity. That's a trap which can be helpful for you in cracking the question related to digoxin toxicity. Okay, now we move to volume of distribution. Less than 5 liter, that is plasma bound. 10 to 20 liter is your extracellular fluid, and more than 40 liter, if it is, then it is tissue sequestration. High volume of distribution examples are chloroquine, digoxin, and tricyclic antidepressants. And trap, what is the trap in this? High volume of distribution drugs are not removed by dialysis. This is the trap. Okay, now we move further. The regulations, trials, and metabolism, drug schedules in India. Schedule H are like your prescription drugs. Schedule H1, your antibiotics, and red box warning like curb resistance and fees. Yeah, sorry. And in your what are the schedule X drugs? They are your narcotics, psychotropics, and schedule G are which are being sold under your medical supervision. Now we move to the clinical trial phases. There are five phases, and what is the purpose of that, and what are the subjects at individual phase. In phase 0, purpose is your microdosing and subjects are very few. And in your phase 1, the purpose is safety and subjects are your healthy individuals. And in phase 2, the purpose is efficacy and subjects are patients. And in phase 3, we do the comparison and subjects are large. And fourth, that is post marketing phase, subjects are population. And adverse effects are detected in post marketing stage, that is your phase 4. Now we move to the enzyme inhibition. In enzyme inhibition, there is a competitive inhibition or there is non-competitive. In competitive inhibition, Vmax remains same and Km value increases, and this is overcome by increasing the substrate. And in non-competitive inhibition, Vmax decreases and Km remains same. So what are the red notes? Prodrugs improves the bioavailability. Like prodrugs examples are enalapril which converts into enalaprilate, codeine which converts into morphine. And what are your CYP mnemonics? CYP mnemonics the inducers are PCRS go. This is a mnemonic. P stands for phenytoin, C for carbamazine, R for rifampicin, S for smoking, and G for greasephulvin, and O for oral contraceptive pills. And in inhibitors, if we memorize by a mnemonic that is VACCAM, V stands for verapamil, A for amiodarone, C for cimetidine, K for ketoconazole, A for acute alcohol, and M for macrolides. By this mnemonic that is PCRS Go, we can memorize the inducers, and by VAC CAM, we can memorize the inhibitors. And what is the storage in cool, that is 8 to 15, in cold, that is less than 8 degrees Celsius, which is used for insulin. And what is forced diuresis? Like your weak acid, that is aspirin, that gets excreted, and in alkaline, that is example of alkaline diuresis. And weak bases, they excretes by uh, acidic diuresis method. Okay, so in this lecture 1, we have studied the general pharma, including your kinetics and distribution, the regulations, trials, and metabolism. And here is your 35 questions quiz. We won't discuss this quiz in here, but if you want to get this quiz, you can give your you can ask for in our comment section, or you can uh, follow our WhatsApp group, in which you will get the link of this quiz sheet, which is including 35 questions based on your general pharma topics. And this was our first lecture, and the remaining 5 lectures will be studied in later on phase. And thank you.